G'day, I'm Fernando. I'm the retrieval paramedic. I just give you a quick handover on Jane. So this is 3-year-old Jane Smith, who we've retrieved from Countryville Rural Hospital, and she's been accepted here under Dr. Jones. So Jane presented this morning to the ED there about 3 hours ago with severe croup. When she presented, she had an altered LOC, she had a biphasic stridor, and she had a markedly increased work of breathing, including she had a tracheal tug and some intercostal retractions. So she was given 5 milligrams of nebulized 1 in 1000 adrenaline and 2.1 milligrams of oral dexamethasone. She did improve, but she did need an extra dose of adrenaline. Now, post the second dose of adrenaline and when the dex took effect, she's markedly improved in her breathing. She's still got a inspiratory stridor at rest. So she's one of the other reasons she's here is that about a year ago she actually was intubated and admitted to a pediatric ICU when she presented with severe croup. She's also had 2 other presentations with croup. She's got congenital subglottic stenosis, and this is why she's been transported here for higher care, obviously, and a review with an ENT and possibly the pediatric intensivist. So in terms of the differentials, at the ED, there was a history of productive cough. So she was really compliant, she was really settled, so they did do a chest x-ray, and they found that her lungs were clear, there was no narrowing at the epiglottis, but you can see some tapering along the upper part and narrowing up on the upper part of the upper trachea, suggestive again of croup. So the rural hospital wasn't too comfortable, however, visualizing her oropharynx with a tongue depressor because she became quite agitated, so they haven't done that. I haven't had to do any interventions throughout transport besides oxygen. She's been quite happy on Dad's lap, and she's been very, very good and settled on the way up. Now, at the moment, her airway she's still got a mild inspiratory stridor on auscultation. Her work of breathing has returned to almost normal. She no longer has a tracheal tug, and her intercostal retractions have markedly improved. Her respiratory rate is 28, and her breath sounds are all clear. She's well perfused. She's saturating at 98% on that oxygen. I think I had it on just 6 litres on a Hudson just close to her face, held by Dad. She's got a temp of 36.9, a blood pressure of 90 on 52, a heart rate of 120, and she's nice and alert. She's a GCS of 15, BGL of 5.6, and her pupils are equal and reactive. I had a good look at her. She hasn't got any sort of urticaria or any rashes anywhere that we can see. And you can see that her respiratory efforts are quite almost normal. Now, systems-wise, she's neurologically stable, no signs of meningism. She's hemodynamically stable as well, and she's had wet nappies and her bowels opened about an hour ago. She's being nil by mouth. They were able to get IV access and keep her well hydrated with 33 mils an hour, just with some saline and 5% dextrose. Adjusted for her weight, she weighs 15 kilos. She doesn't have any allergies that we know of, and she's not on any regular medications. So because of her previous ICU admissions, Mum and Dad are quite well aware of her condition. Mum stayed back, and obviously Dad's come up with her to be with her. So look, that's about it. Did you have any questions that I can answer?